Today in series of Docplexus KOL interviews, we have with us Dr. Umara, who is the director and senior consultant at Sitapati Clinic and Hospital in Chennai. She has a vast experience of 28 years in obstetrics and gynecology. She has several international publications in peer-reviewed journals. Her current research interest includes risk stratification for developing GDM in early pregnancy. Thank you, doctor, for this interview.
Yeah, thank you for asking me.
Yeah, so let's begin with the first question. Could you please elaborate on the Indian scenario of hyperglycemia in pregnancy?
Hyperglycemia in pregnancy is the commonest problem that we see in pregnant women. It's the commonest medical disorder. If you look at data and most publications, irrespective of which part of India they're coming from, 1 in 4 to 1 in 5 pregnant women have some form of hyperglycemia in pregnancy. So it's a significant problem. It's a significant problem not just for the pregnancy, but from the fact that these women have a very significant risk of converting to type 2 diabetes within a 5-year period, and therefore diagnosing and appropriately treating hyperglycemia in pregnancy or gestational diabetes actually gives us an opportunity to identify women who are at risk of becoming diabetic in the future and putting in place intervention that may actually delay or prevent them from becoming diabetic. So from that perspective, it's a huge opportunity, but yes, it's a huge medical problem.
Right. So moving on to the next one. Considering Indian scenario, what are your recommendations on gestational weight gain in pregnancy, and what are the complications that are associated with the same?
Okay, I think we have very clear guidelines on what should be an appropriate weight gain in pregnancy. It's not a blanket single number for all women. It varies based on their starting weight, or rather the starting BMI. And I think it's important that we use this guideline and we educate the woman and her family that in pregnancy for her it would be appropriate to gain a certain weight, more than that. And that's important because in a lot of families people think that a pregnant woman should eat for 2 people. They're always given sweets and high calorie food, and therefore it's very hard for them to maintain that weight gain cutoff or standard if the family is not supportive. So I think therefore that education is important. What are the complications from it? If there's excessive weight gain in pregnancy, clearly the woman's risk of developing diabetes, her risk of developing hypertension is high. And I would go one step further and say that a lot of the women don't manage to lose the weight that they gain in pregnancy, in the inter-pregnancy period. So they're actually starting the next pregnancy 5 to 6 kilos heavier than where they began. And so that is a huge problem. So yeah, so it's important to educate them and get them moving and get them active. Because increasingly, I mean, a lot of times women and families are very scared, and the commonest questions we are asked is, can she walk, can she climb stairs, can she exercise? So I think that is for doctors also to break that myth and tell women it's safe to exercise in pregnancy, I think is a very important message.
Right. Yeah. So moving on to the next one. How BMI is associated with postpartum diaglycemia in Asian Indian women with GDM?
Yeah, so that's what I was saying, that if they start off heavier, then clearly their risk of diabetes in pregnancy is higher. And and if they also then gain more weight, then the concern is that they can have a greater tendency to diabetes later. In one of the projects that we did, which was called WINGS, we found that if you took women with GDM in that project, at the end of 1 year, nearly 20% showed dysglycemia. And so if they then gain weight and they don't test for their sugars and they don't take care, they're going to have a much higher burden of possibility of becoming diabetic in the future.
So, doctor, recent advances suggest that GDM and T2 diabetes share same genetic background. What is your opinion?
I think the risk factors are very similar. There is a high degree of insulin resistance. There have been studies looking at the genetic behavior in both type 2 and GDM, and there are similarities. But sometimes what we diagnose as gestational diabetes may be some other form of diabetes other than type 2, though this is not very common. But I think there has to be more research in this area. But in a practical sense, in terms of managing patients, I think the ground rules are the same.
Thank you so much, doctor, for the interview. It was a pleasure having you here.
Yeah, thank you very
Thank
much.
you.
Yeah.